Why is CF imaging consistency important worldwide? Imaging plays a vital role in managing cystic fibrosis, a complex genetic disease that primarily affects the lungs. Consistent imaging practices around the world are essential for several reasons. First, they help in the early and accurate detection of lung disease. Structural changes in the lungs can begin in infancy, often before any symptoms appear. High-resolution imaging techniques like computed tomography and magnetic resonance imaging are more sensitive than lung function tests alone. By using consistent imaging protocols, healthcare providers can identify early lung damage, allowing for timely interventions that can slow disease progression and improve survival rates. Next, standardized monitoring of disease progression is crucial. Cystic fibrosis lung disease is chronic and requires regular assessments to track changes over time. Consistent imaging methods and scoring systems enable clinicians to compare results reliably. This is particularly important as new therapies targeting the underlying genetic defect become more widely available. Regular imaging helps adjust treatments based on how the disease evolves. Imaging also guides targeted treatment decisions. It can help differentiate between various causes of lung issues, such as bacterial infections versus fungal infections. Accurate imaging ensures that these distinctions are made consistently, which is vital for effective and personalized care. Another important aspect is reducing radiation exposure while maintaining diagnostic quality. While computed tomography scans provide excellent detail, they involve ionizing radiation, which can be a concern for patients who require frequent imaging. Magnetic resonance imaging offers a radiation-free alternative, but it requires standardized techniques to ensure high-quality images. Consistency in imaging protocols helps balance the need for accurate diagnoses with patient safety. Moreover, consistent imaging standards support research and clinical trials. When data is pooled from different centers and countries, it facilitates research into cystic fibrosis and helps establish evidence-based guidelines. This harmonization accelerates advances in care and improves treatment options for patients. Finally, as more individuals with cystic fibrosis live into adulthood due to improved therapies, consistent imaging becomes even more critical. Adult healthcare providers need to recognize the full spectrum of cystic fibrosis manifestations and monitor complications that may arise later in life. Consistent imaging practices ensure that these patients receive continuity and quality of care, regardless of where they are treated. In summary, worldwide consistency in cystic fibrosis imaging is essential for early detection, accurate monitoring, targeted treatments, minimizing risks, and supporting research efforts. This consistency ultimately leads to better health outcomes and improved quality of life for individuals living with cystic fibrosis across various healthcare systems.